Welcome to Shape Your Life, the show that's all about matters of your health. I'm Ronald Avergy. In the month of March, we commemorate TB Awareness Month. And in this episode, we're hoping to dispel some myths about this disease. Here's more of what we've got in store for you today. Can fruities put a dent on one's smile? We dispel myths about TB. And the best foods to eat while on medication. Another informative show which also includes our weekly exercise routine. First up though, here's a look at your health news.
In your health news, it seems fruit tea lovers have been dealt a dent to their smile, with dentists having warned that the acid in fruit teas can erode one's teeth as they wear away enamel and raise the risk of needing a filling. Apparently, even a mug of hot water and a slice of lemon is dangerous simply because the fruit contains 6 times the citric acid concentration of lemonade. The King's College London Dental Institute found fruit teas to be acidic, especially when consumed twice a day between meals, causing severe tooth erosion. Fruit's natural acids corrode teeth faster when heated up with hot water, with the exception of rosehip or berry tea if drunk with a meal. In other news, it seems taking daily fish oil capsules during pregnancy and during the first few months of breastfeeding reduces the risk of the baby getting food allergy. Fish oil contains omega-3, a special fat that has a positive anti-inflammatory effect. Researchers at Imperial College London confirmed that diet in pregnancy can influence the development of allergies in the early life, especially if one is taking probiotics and fish oil supplements.
TB is a chronic infectious disease caused by a bacterium called Mycobacterium tuberculosis and can affect any part of the body. We spoke to Dr. Judith Mwansa-Kamafwile, an epidemiologist from the NICD, to find out more about it. Thank you so much for joining us on Shape Your Life.
Thank you.
When it comes to TB, we know it's a serious concerning factor globally, but especially in South Africa. Why is that, and are we managing to fight this burden that's affecting us?
So TB is a problem in South Africa, like you've said, and part of the reason is because not everyone actually presents to the facilities to get tested for TB. So we have some undiagnosed TB out there, and as such, we cannot exactly estimate the burden that we've got. Yes, we'll say we have a high burden of TB, but there's some undiagnosed TB out there that we still need to diagnose.
But why is TB such a concerning factor?
So number one, TB is treatable, it's curable. So when you have a disease that's treatable, the best thing to do is to treat it. You diagnose it and you treat it. So if we're not able to do that, then that is very concerning. Part of the reason why most people don't get tested for TB is the stigma around TB. TB is associated with HIV. But again, when you think about it, not everyone that is HIV positive, HIV negative, will escape from getting TB. TB can affect HIV negative, HIV positive people. And the stigma around it, people should think about it in terms of icons that we've had that have had TB and it's been treated. Nelson Mandela had TB, Desmond Tutu had TB, and both were cured of TB. So if we look at TB in that manner, that it can be curable, there's no need to fear. People can go, they can get tested, they can be treated, and the treatment is short. It's 6 months for normal TB and slightly longer for TB that's not normal.
Now, when it comes to signs and symptoms, what should people out there be aware of that says to them, okay, stop now, let me go to my clinic, let me get myself tested for TB?
So there are 4 key symptoms that people should look out for, although there are more, but I'll mention the 4. So if you're coughing, that's a source of concern, especially if it goes beyond 2 days. You should definitely go and get tested. If you have fever, if you're losing weight, unintentional weight loss. I mean, there are people that will lose weight because they want to lose weight, but unintentional weight loss. So it's fever, night sweat, unintentional weight loss. And there are other symptoms that can come with it. So a person can be coughing, coughing up blood, then you should be concerned. You can have chest pains. That also can be a source of concern. And then again, TB affects the lungs primarily, but it can affect any other part of the body. So those symptoms that I've mentioned, it's when you have pulmonary TB, the TB that will affect the lungs. But depending on the part of the body that's affected, the symptoms will vary. For example, if the TB is affecting the brain or the meninges, one can have symptoms of meningitis, neck stiffness, maybe even convulsing. That can be TB. It can affect the kidneys, it can affect the liver, it can affect the joints. So TB can affect any part of the body.
But knowing that, how is TB spread?
So TB is airborne or by droplet infection, meaning it's just when someone coughs and then it stays in the air and then another person can breathe it in. So the problem that we have is when a person coughs, it's not like there and then the TB germs will leave that environment. They actually take very long to settle. It can take up to, if someone has been in this room and they've coughed up the TB bacilli, the TB germ, it can take up to 6 hours that the germ is still in this room and it hasn't even gone down because it's very light, it's small, it's by droplet infection. So it's by breathing in, and you really don't have control of where you breathe in. Yeah.
What about treatment? What are the treatment protocols available for people out there? Is it difficult? Is it painful? Because once you've been identified, the thing is to find the right treatment and stick to that, if I'm correct.
Yes. It's very important that once you're diagnosed with TB and you're put on treatment, you actually adhere to the treatment until you finish the course. In terms of diagnosis, it's not something that will be invasive. You just need to cough up, you cough up sputum. So it's not anything that will hurt. You just cough up sputum in a bottle and they need to be taken to the lab. Then when they find TB, they'll put you on treatment. Like I said again, depending on which part of the body, some diagnosis may require that they do maybe an X-ray or they inject. Yeah, but it's a small prick if they have to get some fluid and test if it's got TB. And then in terms of treatment, the treatment is, like I said, standard treatment, it's 6 months. And then for more complicated TB, like for drug-resistant TB, it's now only 9 months. Wow. And you're treated.
I think that's a big message to have. As long as people adhere to the medication protocols and take it timelessly, because many people, get diagnosed with TB, go onto their medication regimes, and they realize, my cough is now stopped. I'm feeling better. Let me stop. And that's the wrong thing to do, if I'm correct. You need to push through for the duration that the doctor has prescribed.
Definitely. And because once a patient starts taking treatment, you start to feel better within a few days. So one can easily stop taking the medication. You start to feel better, and by the time it's 2 months, you find some have defaulted, they've stopped taking their medication. And then another message is that once you put someone on treatment, then they won't be infectious. That's a very important thing to note. Because if I have TB and I'm put on treatment, the risk of me transmitting that TB to other household members is reduced within 2 weeks, up to a month. But within 2 weeks, I should be, I'm not able to transmit to my colleagues or my housemates.
I think it's a wonderful thing and a wonderful message to take in is that, yes, it's not an excuse to get 6 months paid leave, but it's being conscious of those around you. Thank you so much for your time, for sharing your insights with us on Shape Your Life.
Thank you.
TB is a global problem, and the goal is to have a TB-free world by 2035. We have more on this disease after a quick commercial break. After the break, we unpack the work at the Center for TB and what to eat whilst on meds. Stay tuned.